The youth with a mission ship sailed out into the remote parts of Gulf and Western provinces last week. The Pacific Link provides a lot of health essential services, but the people who provide the services are volunteers. They willingly give their time and effort. Delhi Bagu with this report.
With the poor health indicators around the country, especially in the not so easy to reach places, every help given is valued. The Youth with a Mission, or YWAM Medical Ships, is an organization that employs volunteers, and they provide basic health services and training to the people that live along the coastline of the Gulf and Western provinces. YWAM's operations in PNG began 3 years ago in consultation with the PNG government and the National Department of Health.
Well, we came up here 3 years ago to see the then Secretary of the National Department of Health, a number of ministers and politicians at that time. So that's when we really started the idea of bringing a permanent medical ship here to Papua New Guinea. But we've now been servicing PNG since 2010. Our first service delivery was into the Gulf province. We've just finished our third trip into the Gulf province, and of course two provinces. The other province we've done is also the Western province. So in that time, 74,000 health outcomes.
The 74,000 health outcomes are a huge assistance for PNG's health indicators, and especially for the people who live along the coastal area. And YWAM aims to maintain this improvement through existing manpower on the ground.
The most important thing for us is actually having Papua New Guineans working side by side with us. We do ophthalmology, which is a specialist operation with the eyes, the cataract operations, dentistry, optometry, and also primary health care and community development in the villages as well. Whenever we can, we really ensure that we are working with Papua New Guineans beside us. That's that capacity building and making sure that we have PNG people in the field themselves working with us.
Every year, an estimated 4,000 children under the age of 5 die. Almost all of them die from preventable diseases or inadequate health care at birth. Mr. Reynolds, who is the patron of YWAM Medical Ships Australia, announced that we now have a patron for the YWAM Medical Ships PNG.
We're delighted to be able to announce that we've appointed Surabi Namalu, very distinguished ex-Prime Minister of Papua New Guinea, to be our patron here in PNG. That's a really good appointment to be able to announce. I'm the patron for YWAM Medical Ships in Australia, and to have such a distinguished Papua New Guinean as our patron here in PNG is extraordinarily important for YWAM Medical Ships.
The YWAM Medical Ships program is helping to fill a real vacuum in basic health and community life, family life needs in Papua New Guinea. The excuse for the tyranny of distance, terrain and remoteness are used to explain why around 6 million men, women and children in Papua New Guinea don't get the basic services they need. It is an excuse, but not a justification.
And when you look at the rural and remote areas of PNG, you really need to be able to go up the rivers, go up the estuaries and so on. We have a very shallow draft with the ship, so we're able to access areas where quite often, people haven't been able to get to for many, many years.
We work in the very remote places, so places that's very difficult to access. We work very closely with the local healthcare worker when one is present. So we see a lot of malaria, wound care, maternal health, do a lot of childhood diseases, immunisation, just a lot of the basic problems that maybe have escalated just to the remoteness of where they are.
The medical ship itself, the Pacific Link, carries the medicines and medical equipment, more like a floating clinic. It's Pacific Link's third time up in PNG, spending up to 6 months of the year in the waters of Gulf and now the Western Province. The regular visits has its advantage.
Probably my favourite part is the fact that we go back to the villages each year. So we build on what we're doing each year. We build on education, we build on training, and although we see people improved in their healthcare, they don't necessarily come with the same problem. We see an improvement. So For instance, when we first started working, we did a lot of emergency dental work, a lot of extractions of teeth. But this year, because we've been going back there regularly and doing education, we're now starting to see an improvement in oral hygiene. We're doing more restorations and extractions, which is exciting.
Sarah Binamaliu said the Youth with a Mission Medical Ships program is starting to fill a real vacuum in basic health needs in PNG. As YWAM is made up of volunteers, support like that from steamships is valuable. Steamships assist the operation with 400,000 kina yearly, as well as provides the berthing space at the steamship's coastal shipping.
And for steamships, that is a big part of our corporate social responsibility package, and something we're very proud to be associated with.
For the volunteers on board Pacific Link, it's all hands on deck. Dentist and founder of 100 Smiles Limited, Dr. Daryl Holmes, joined the YWAM Medical Ships, overwhelmed by the amazing concept and services the ship was delivering in the South Pacific. He's been supporting financially, as well as being on outreach for 3 years as well. The dental clinic provides first-class service. Senior dental students from the School of Medicine have been encouraged to join the outreach for the unique experience.
We look forward to having university dental students, 4th and 5th years here, Thursday and Friday I think this week, with their lecturers and staff, so we're trying to build that bridge, which they're a bit sceptical I'm sure, but a few other medical contacts we've got, so we're trying to open our doors, bring them on board and try and lift the standard. And what we'd love to do is we hear that so many of these students finish dentistry, then the government provides a year of internship and then there's no jobs. And we'd love to be again having as many of those on board every outreach to come and get some experience, because I tell you my record once in the Gold Province was 131 extractions in a day, and look, you don't get that experience in Australia in 5 or 10 years, or maybe more. So 750 extractions we did that week, and that's just incredible from an experience point of view.
Not all the volunteers have medical backgrounds. Kim Cooper was a finalist in the 2009 season of the Australian Idol.
Everybody look to the left, everybody look to their right. Can you feel that? Yeah, we're paying with left tonight. It's not about the money, money, money. We don't need your money, money, money. We just want to make the world dance. Forget about the price tag. Ain't about the cha-ching, cha-ching. Ain't about the, yeah, the bling, wanna make the world dance. Forget about the price tag. Okay.
Everyone who works on board the YWAM Medical Ship brings away unique experiences.
I think one of the great things about YWAM, Youth with a Mission, it does have a Christian ethical background, and the people of PNG do as well. You know, many of your services here are delivered, by the churches out in the provinces, and also, of course, by your national and provincial governments. So we find that we're very welcome. Now, that Christian ethic in a country like PNG is very important to people, but we don't press that on people. We're really here mainly, of course, to deliver those medical services, to capacity build PNG people, to train PNG people.
I think the absolute highlight is always the people. I mean, I've been doing this for a few years now, and not once I've arrived in a village where we haven't been warmly welcomed, and when I haven't met the most amazing people. And, they don't have a lot to offer in some ways, but they have so much to offer. And just to be able to work with them and build with them and see their communities grow is an absolute privilege. And I'm always pleasantly surprised at the healthcare workers we find and just what they're doing. And any way we can help them and any way we can work together is always a highlight.